So patients with inflammatory bowel disease have many other conditions. Some of them are related to their inflammatory bowel disease. This can include eye inflammation like uveitis, joint inflammation like ankylosing spondylitis. They can get skin reactions, psoriasis type reactions. They also have other issues where the medications they use may increase their risk of cancers like skin cancer or infections like HPV. So if it's related to disease inflammation, for example, the eye inflammation, the joint inflammation, if you control their inflammatory bowel disease, that can get better. And so that's easy. You treat their underlying inflammatory bowel disease and a lot of the joint and eye conditions will improve. What's harder is that the medicines that you use to treat it can then lead to conditions like abnormal pap smears or a psoriasis-like rash, and then you have to deal with those complications. As gastroenterologists, we essentially just need to be able to recognize that it's a complication of either the medication or the disease and have a network of specialists that we can refer them to, for example, for eye or for skin. Also, we want to be preventative in these patients, and so as a gastroenterologist treating inflammatory bowel disease, I have a printout for patients to take to their primary care physician, and I also put it in the letter to the primary care physician talking about healthcare maintenance. So patients with inflammatory bowel disease should have annual eye exams to look for glaucoma from steroids, to look for uveitis. They should have annual dermatologic evaluation either by their primary or by a dermatologist to rule out skin cancer, and that's even further increased if they're on or immunomodulator or biologic therapy. We also give them a list of vaccines that should be updated, and that includes HPV vaccine for both males and females. It includes annual influenza shots, pneumococcal vaccinations. If you think you're going to put a patient on a biologic, then live vaccines are contraindicated. So if your patient needs a live vaccine, you should do it before you start those medications.